My name's Lyn. I am the Learning Disability Screening Practitioner for Bristol, North Somerset and South Gloucestershire. So I'm just going to talk a little bit today about my role and some case studies that of people that I've worked with over the last 2 years that I've been in my role. So when I started my role, the vaccination screening team gave me the aim to increase the uptake of cervical, breast, bowel, AAA and diabetic eye screening for people with a learning disability in my footprint. So that's the adult national screening programs. So I work with people with a learning disability. So I offer regular training to them about health screening to give them information so they can make an informed decision about going for screening. So I've noticed in the chat there's somebody else has used some dummy or anatomical models to model screening, and that's a lot of the stuff that I do. So I take the anatomical models of breasts and of the cervixes. I also have some testicular models so we can teach about self-examination. And I visit care homes, day centres, any kind of setting really in Bristol, North Somerset and South Gloss, and teach people about their bodies so we can empower them to make informed decisions. I also talk to their carers and do a lot of education with carers so that the carers can then talk to the people that they support about screening. Also a lot of signposting to local screening programs and primary care to encourage the support workers and to empower the support workers to request reasonable adjustments for the people that they support. And then also I support primary care and the screening programs as well to highlight health inequalities, promote the use of reasonable adjustments and offer specialist knowledge, advice and guidance in my role as a learning disability nurse. So if there are any practices, primary care colleagues from Bristol, North Somerset and South Gloucestershire in this call, then feel free to contact me afterwards and we can have a discussion about how I can support your practice to increase the uptake for people with a learning disability in your area. So next slide, please, Kim. So as I say, I've just got a few case studies and the first one is about breast screening. So these are all real people that I've supported over the past couple of years, and hopefully you'll see our role that we are doing in the Southwest and also the importance of adjustments in cancer screening care. So this was a 57-year-old woman with a learning disability. She'd never been to breast screening before and she lives in a residential care home in Bristol. So I visited her twice. The first appointment was to meet her, to gain a rapport with her, to kind of assess her communication. And then the second visit was to take lots of accessible resources. So there's a really good video that the Bath Complex Care team made with the Avon breast screening team. And it shows somebody having a mammogram done. So I showed this video to her. I took some easy read leaflets and I took lots of pictures. And I also used the anatomical breast model so I could model what having a mammogram would kind of look like, and she could see that on kind of the breast model. I facilitated a pre-visit, a familiarisation visit to the Avon breast screening unit so she could have a look around, she could meet the staff, she could have a look at the mammogram machine and just kind of get used to what the environment is like. So we then booked her an appointment and that mammogram was successful, but further investigation was required. She later required a biopsy under sedation and she was diagnosed with breast cancer. She's now receiving treatment. So it just goes to show, so as Alison said earlier, people with a learning disability are often diagnosed later on. And also this lady was a black woman and they're more likely to be diagnosed with later stage cancers compared to white women. So if we hadn't have supported this lady to go, then who knows what the outcome would have been later on down the line. So the importance of desensitization was really important here so that she could see what was going to happen to her. She could have a look around the unit, giving her the information so she could understand what was going to happen overall to reduce the health inequalities for this person. So next slide, please. So next case study is a gentleman I supported with bowel screening. He was a 69-year-old gentleman. He had a learning disability and he was autistic, and he had never completed bowel screening. So this gentleman lived with his sister, but they were kind of led separate lives. He was very independent, going out every day, and she kind of did her own thing too. So I met this gentleman at his day centre, and I identified the barriers straight away. He told me that he didn't know what the bowel screening kit was for when it came through the post. He didn't want to send his DNA through the post. He thought it was a bit weird. He thought it was some kind of conspiracy that, you know, he was sending his DNA away. And also he didn't know how to collect a fecal sample. So he said to me, do I have to poo on the floor? So there were lots of barriers that I identified. So I spent quite a lot of time with him to explain the bowel screening kit, why it's offered, what it is, what it tells us, where it goes. And I used a demonstration kit, and I used Play-Doh as poo, and I showed him how to complete the kit by himself. And I also used some accessible resources. So I gave him the Easy Read leaflet, and there's also a really good video by Health and Hull, which I use quite often, which sets out really clearly on how to get that poo sample. So he went away, and he rang me a few days later to inform that he successfully completed it, and he sent it off in the post, and he said it was easy and it was fine. And then he rang me a few weeks later and he said the results are fine, I've got a negative result, and I will be able to do this in 2 years' time, so I won't need your support anymore. So in promoting kind of choice, inclusion, in ensuring that he was participating in what we were doing it together. I really empowered him to make a decision about whether he should be doing the bowel screening kit or not. I improved his health literacy, so he knew. I also told him about the red flags of bowel cancer, so he knew to look for blood in his poo in the future, and all sorts of other things to reduce health inequalities, to make sure that he was supported in that remit in the future. Okay, next slide, please. So I've got a case study about cervical screening. So this lady I'm still working with at the moment, so we haven't actually got an outcome for her. But she's a 46-year-old woman with a learning disability. She lives alone with support, and her support workers are visiting her daily. So we had a referral to us. So there's an acronym here. The ALDHS is the Adult Learning Disability Health Team. That's the CLDT. It's what we call the CLDT in Bristol. So we had a referral from the GP requesting support for cervical screening. She tried it in the past, but it was unsuccessful. So I visited her at home. And as soon as I arrived and I had my bag of kit and I had my bag of, my model cervixes and my speculums, as soon as I got the speculum out the bag, she visibly recoiled, and it was really obvious to me that she had quite a big fear of speculums. So we had a big discussion around this, and then we also had a discussion of what could help her attend a cervical screen in the future. So together we identified what adjustments she might need. So I left her a small speculum in her house so she could be around it, touch it, have it in her house, just kind of have it around, so she could familiarize herself with that piece of kit. We requested an appointment on a specific time of day and a date when she had support. She had access to a pets therapy dog, so we asked the GP surgery if a therapy dog could come with her, and they said yes. They were very accommodating. And we also asked for a longer appointment. So her appointment is due in December. This isn't an end date, so if she doesn't want to go on that particular December morning that she's requested, then we can try another day. There's no, we can just keep supporting her over time to attend. Again, promoting choice, so giving her the choice of what adjustments she might need is really handy and helpful. Promoting independence, inclusion, and having her participate in the discussions is really helpful. Again, improving health literacy and overall reducing health inequalities. So next slide, please. So the last case study I'm going to present on is a gentleman I supported with AAA screening. So this is a 65-year-old man who lived in a residential care home. The AAA screening program coordinator contacted me to inform that he hadn't attended his appointment. He just didn't turn up. So I called the care home, and the manager of the care home said that this gentleman didn't currently have a wheelchair suitable for use in the community, so we couldn't go out. The physios in our CLDT already knew about this issue, so it was already being, you know, he had support to for his wheelchair. But I spoke to the physio who gave me verbal advice about what to say to the care home, and then I relayed back to the care home, and I think that set things in motion a bit quicker than they would have if I hadn't have been involved. The care home advised me when the wheelchair was fixed and he was able to leave his house for appointments, and then I was able to tell the AAA screening team to book an appointment, and then he successfully had his AAA screen. This is just one example of improving something in somebody's life in a holistic way, which has impacts throughout his whole life. So he could then go to his health appointments, he could then go shopping, he could then go to his day centres, he could, you know, do all sorts of things. But if it wasn't for me kind of nudging the physio and then nudging their care home team, it might have taken a bit longer for him to have all these things done. There was a bit of MDT working involved, and it's just important to get over these barriers so that he then could attend his AAA screening appointment to reduce health inequalities. Okay, next slide, please. So in terms of diabetic eye screening, I just wanted to highlight a couple of resources that you could use if somebody has a learning disability and wanted some accessible information. So there's the really good diabetic eye screening storyboard or social story by InHealth. The link is below that image there, and you will get these slides. And then there's the Diabetic Eye Screening Easy Read Guide by NHS England, which is also really helpful. Okay, next slide, please. So I've just got some kind of my top tips for screening for primary care. This is mainly aimed at. So if we code patients with a learning disability correctly, they can be offered reasonable adjustments for screening. And there is some guidance on coding and identification. Yeah, if they're flagged as having a learning disability, then we know that that person will probably, not always, but need some kind of adjustment to help them attend. You can share information with the screening programs. This comes under direct patient care under the GMC guidance. So if you get a request in from the screening programs, you can give them patient details. Really important to discuss screening during annual health checks and to record these discussions. So studies have shown that GP endorsement or a healthcare professional endorsement can affect that person's willingness to attend that appointment. So if you're endorsing screening, then that can really help. Think about reasonable adjustments, which we've all talked about today. Follow the Mental Capacity Act and record all decisions that you're making. And if you're struggling with supporting somebody to attend, ask your local learning disability screening practitioner or your CLDT for advice, and they can give you information about the Mental Capacity Act or to support somebody who is reluctant to attend or who is not responding. Next slide, please. So I don't expect you to read all of this. This is a lot of information, but this is lots of easy read information, books beyond words, and videos about the adult screening programs in England. So yeah, it will be sent to you. And next slide. So we have some screening videos. So I know that Greater Manchester have just come out with this amazing suite of cervical screening videos. So we've done very similar in our down in the southwest. And I think Kim, if you could share those little snippets of our cervical screening video, that would be great.
Get them up now.
Thank you.
go for a cup of tea, thank you.
You're very welcome.
Everything okay?
I just received this letter. I don't know what it is about.
Oh, let me have a look. I've had one of these before. You've been invited to have a cervical screening test.
A what?
A cervical screening test is a test that could save your life. I always have mine when I am invited.
I'm glad that you know about the test.
The test is done by a nurse who checks the cervix, which is an area inside the vagina.
Oh.
They are sometimes called smear tests. I was worried about my first one, but it all turned out okay.
It sounds embarrassing. So do I need to have one?
Oh, the nurses who do the tests were very nice to me and made me feel very comfortable when I had mine done. The choice is yours, but it is important, so I think you should get it done.
I was embarrassing first, but when I get there, I was fine.
It's a really good test as it can help prevent cervical cancer.
Really?
It checks to see if you have HPV. If you do, you can have checks to see that you don't get cancer.
What is HPV?
HPV is simply an infection that is passed through skin-to-skin contact.
Thanks, Kim, for sharing that. Yeah, so that's just a little taster of our video. We've also got a AAA screening video as well. So please do share and have a little look. The cervical screening video, I think it's 17 minutes long, but we've clumped it into shorter segments. And then one final thing on the end of my slides, there's some contact details for the screening practitioners in your areas. And that's it from me. I'm going to hand back over to Alison.